Morning, everybody. I'm Congressman Pat Ryan, representing the 18th District of New York, home to all our alma mater, Captain Reynolds, among other great places, including the Castle Point VA, where I am a patient along with 40,000 other American heroes that I have the honor to represent. I served 2 combat tours in Iraq, and I will be damned if we all, as Americans, allow the Trump administration, a draft-dodging coward, to disassemble and dishonor our veterans. And I just want to thank you all for being here this morning. We have 20 inpatient beds at my own VA now closed because of his hiring freeze, not hypothetical, but real, and we all know the impacts that will have. James, thanks for being here. I also want to just, as a dad of 2 young kids, commend you and your wife on your well-behaved children. I got to get tips from you on that later.
Melatonin.
I appreciate that. You've talked about this a little bit already, and I appreciate what you said, which is this isn't about you, it's about our veterans. But can you talk about what it's felt like for you, given all you've done, and all the sacrifice you've made, to walk into the VA that day and be treated that way?
Well, thank you for that. That's a great question. It was discouraging. We had spent 3 years rebuilding the trust that minority and Black, brown, LGBTQ veterans had been dismissed for some time. Spent 3 years doing that, developing more targeted approaches. We conducted veterans unity villages, for example, with the NAACP in their national conference, and we brought the VA to the community. That was our effort. So we would have mobile units, NCA, all the facilities. We basically created a mini VA inside their conference. And when the deputy secretary at the time addressed the general session, and she said, how many of you in here, there's about 9,000 people in the room, how many of you here are veterans? Half the room stood up, right? And if we don't bring the VA to the community, they're not going to come to us. They're not going to come to them. So having built that trust over time, having built the relationship with LULAC and NAACP and other organizations, I fear that if that doesn't continue, we're going to go back to an environment of distrust.
Thank you. Thank you. Captain Reynolds, thank you again for being here. Duty, honor, country, and we're incredibly proud of you and the continued service. You talked about this as well a little bit, but can you explain to folks that might not be patients of the VA, might not be veterans getting this care, what are these cuts, the Doge and Musk and Trump cuts that your business was providing, like the contract specifically canceled? What does that mean to a veteran that had been receiving that care? Can you help bring some color to that for us?
Absolutely. Thank you for the question. We all know the big efforts to bring together the 2 systems on the left and the right, the DoD and the VA, with their interoperability of their health records. My company was able to provide a lot of that support to the military health systems for 3 years as they successfully deployed that health record system. And then naturally, we moved over to the VA to help with the same support as they were embarking on that same deployment. The VA is a much larger system, more fractured system, so it was a more complex deployment. So naturally, it had more support and a higher contract value to help with that deployment. The VA has been slower at its deployment, so we're now delayed in achieving that interoperability with the military health systems. And although the VA wants to accelerate the deployment, they no longer have that same support structure for it. It's inevitable that they will see more patient safety incidents and a slower deployment despite wanting to roll out the system faster.